asthma and short breath.
So beautiful! How can we get it? Asher, what do you say?
Tablets.
Nebulizer.
Inhalers.
Syrup.
Okay, take your prescribed dose of 4 puffs by mouth 4 times a day as needed for shortness of breath or coughing fit.
Thank you! I feel much better now that my bronchial airways are dilated! The uses of salbutamol are prevention of exercise-induced asthma, acute bronchospasms, bronchitis, emphysema, bronchitis, and other reversible airway obstructions. The unlabeled uses are hypokalemia in patients on dialysis and COPD.
So for pharmacokinetics, by mouth, the onset is within 30 minutes, the peak is 2 to 3 hours, duration is 4 to 6 hours, and the half-life is 2.7 to 6 hours, and it's well absorbed. If it's taken by mouth and is enteric coated, the peak and onset are the same, but the duration is 8 to 12 hours. If it's taken by inhaler, the onset is within 5 to 15 minutes, the peak is 1.5 to 2 hours, and the duration is 2 to 6 hours, and the half-life is 4 hours. And the medication is metabolized in the liver and is secreted via urine and fecal matter.
The side effects of salbutamol are tremors, headaches, dizziness, hyperactivity in kids, chest pain, nausea and vomiting, bad smell or taste changes, cough, and dry throat.
Other side effects are stimulation, restlessness, hallucinations, irritability, flushing, palpitations, tachycardia, angina, hypo and hypertension, chest pain, dysrhythmias, dry nose, muscle cramps, heartburn, sweating, hypocalcemia, metabolic acidosis, wheezing, dyspnea, paradoxal bronchospasms, and dry throat.
So beautiful!
Okay, some of the contraindications are hypersensitivity. Use cautiously in cardiac disease patients. Hypertension, hypothyroidism, diabetes, glaucoma. Excessive inhaler use may lead to intolerance. If you are pregnant or breastfeeding, please speak to your doctor before use. In geriatric and children under 2, this may increase the risk of adverse reactions.
Mechanism of action. It causes bronchodilation by acting on the B2 receptors by increasing levels of C-AMP, which relaxes smooth muscle and produces bronchodilation, CNS, or stimulation, as well as increased diuresis and gastric acid secretion.
Adults and children over 4 years of age should take 2 puffs every 4 to 6 hours as needed. For other respiratory conditions, adults and children over 12 years of age should take 1 puff every 4 to 6 hours. And then if it's an oral tablet, it should be 2 to 4 milligrams, 3 or 4 times a day to a maximum of 32 milligrams. For geriatric and children, like young children, for nebulizers, it should be 0.1 to 0.15 milligrams per kilogram per dose.
This is health teaching for salbutamol. If you have a paradoxal bronchospasm, stop the product immediately and call the doctor.
When you get a new puffer, you're going to want to shake it up. And then you're going to want to do 4 puffs to prime it. And you're going to want to keep it away from your eyes while you're squirting it. Every time you get a new puffer, prime it. If you haven't used it for 2 weeks, prime it again.
And there are certain things you want to avoid while you're on this medication. One of them being smoking.
One of them is stay away from caffeine.
And stay away from people who have a respiratory infection.